Hi, I'm attorney Gregory Dell, and I'm here with attorney Stephen Jessup, and we're going to discuss internal medicine and family medicine doctors and long-term disability claims, specifically about applying for long-term disability claims and issues that we see come up a lot with long-term disability denials and whether you require an appeal or a lawsuit. We've helped a lot of family medicine, internal medicine, board-certified doctors, and the thing I always like to talk about, especially for um, this type of doctor who's looking for information, is they need to know up front that usually the disability carrier is not really going to understand the duties of their occupation, and they're likely going to mischaracterize it as a sedentary occupation. And that's a really sad thing because it's far from a sedentary occupation. So, you know, how do you like to present the claim, Steve, in order to explain what a family medicine, internal medicine doctor does so that the disability carrier doesn't misconstrue the duties of that occupation?
Yeah, and I think, Greg, starting with what you said with sedentary, I think it's disappointing that they even try to classify what a doctor does simply as, what the physical demand, of it is. But you're right. I think of all the medical professionals we represent, internal medicine doctors get the least amount of, I don't know, we'll say respect or credit from the insurance industry. I think there's this general misnomer that, if you have a cold or you think you have strep, you go to your family medicine doctor, they write you a prescription for antibiotics, they give you, a lollipop and you're on your way. Where the reality is most people will go to their urgent care to do that type of stuff. Family medicine is really a lot of times the first point of contact for a lot of people. It's no question that chronic illnesses are very prevalent in the United States, and people generally start with their internal medicine doctor, going for the initial treatment, what's going on, monthly checkups, things like that. The internal medicine doctor, I've said it, multiple times, even to clients who have specialists who don't necessarily want to fill out paperwork. An internal medicine doctor to me is like a quarterback. They understand everything that's going on and they help coordinate your care and your treatment with your specialist. There's internal medicine doctors that they'll go and see their patients if they're in the hospital, make rounds that way. So an internal medicine doctor really is the first and most important vital step for a lot of people's general medical care. And what we've seen even more so outside of these smaller, practices that we're used to is these concierge doctors where it's almost 24/7 access that you can get a hold of the doctor. And they are generally seen more in the community. You and I have talked. You can run into your general medicine, internal medicine doctor in the grocery store or something. So they're also members of the community, and there's a heck of a lot more interaction. And I think a lot of people have a lot of trust in their GP and in that doctor. And coordinating their care. So for an insurance company, it's so important to really get it to the heart of the level of treatment they are giving, what is required of them, because if they miss something, right? If they miss something, they don't get that person over to a specialist for further testing. You always go back to this idea of patient care and the direct harm that may arise from that. So internal medicine doctors, I think a lot of times almost get treated the same way an insurance company will look at as a nurse, but there's a heck of a lot more that goes into that profession. And why the insurance companies don't, I think it's because there's no real surgical duties whatsoever. Insurance companies don't necessarily see how a medical condition may be impacting their ability to do it.
And with the internal medicine doctors, what we see a lot because they know so many specialists, and I think one of the things that sometimes makes it challenging for us, and then on the other flip side, why an internal medicine doctor should be prepared, is that they are generalists in the sense that they know every system of the body and they know what's going on. And when they have their own medical condition, they unfortunately will a lot of times self-treat, or they'll call a colleague and say, hey, here's what's going on, or can you see me? And they do a lot of off-record treatment. And they do that for a good year or two, and then they call us and they want to file a claim. Can you explain why that can be a problem in terms of getting claim approval by not having on-the-record treatment versus off-the-record treatment?
Yeah, we always talk about this idea of diagnosis isn't disability. More often than not, 99% of the time, an insurance company isn't going to question that you have a diagnosis. They're going to admit, yes, you are diagnosed with these medical conditions. However, we don't see it resulting in a disability. And disability is a technical term under the terms of your policy. You have to meet that standard, and that's usually impairing your ability to do the job. Well, the number one way that they're going to find out, how your diagnosis is impairing you is by looking at the medical records. And if you're doing a lot of stuff off the record, off the books type stuff, there's no paper trail. It's them having to take your word. Well, I spoke to this colleague and this colleague told me that. On the flip side of that too, the insurance company will say, well, it couldn't have been that bad if you didn't get the formal treatment. And that's why a lot of these policies too will have that you have to be under the appropriate care of a physician. So that means you have to be someone, and that generally also means you can't treat yourself and you can't have a family member treat you. So your medical records are the foundation upon which your disability claim is going to be built on. If that's missing, if there's not information there, the insurance company's not going to approve that claim. They're not going to take it you at your word that you're having a hard time doing your job. This is a matter of establishing a burden of proof that is beyond your medical condition. It's a legal burden of proof, if you will.
Another issue we encounter all the time is that the family medicine doctor, let's flip and say you have a family medicine doctor that's been going to the neurologist or going to the orthopedic doctor for whatever it may be, and they've been doing that for a 2-year period, and they're grinding through their medical condition. Now, Steve, the disability carrier is going to ask for their CPT production reports.
Mm-hmm.
Family medicine doctors, unlike a lot of the surgeons we represent and the other surgical type specialties, have mostly in-office codes that say level 1 or level 2 examination. So there's not a lot of variety in the codes. They're pretty standard because there's very few procedures in office that a family medicine doctor is doing because it's not really what they do. And the issue is that they've been treating for a year or two. Their financial earnings have remained pretty stable. The number of patients they've been seeing is pretty stable, but they're sticking it out. They're working hard. They don't want to give up their job because they're going to make less on disability than they do working. Mm-hmm. And now they want to file the claim. And the disability carrier says, you've been doing this all along. We don't see a reduction. We know you have this diagnosis, but why now are you disabled? So how do you deal with that? And what do you recommend to a doctor that you're representing to avoid that situation?
Yeah, because in that situation you described, you're working for the insurance company. Because like you said, that idea of disability is the inability to do your job or the inability to do the duties on a full-time basis if you have residual partial disability in your policy. So if a doctor has already filed the claim, right, in the situation you described where there's no reduction, there's no loss of earnings, it's very, very hard to try to salvage that in a lot of ways. However, if you are thinking about, if you've been treating for 2 years and you have policies, it's probably crossed your mind. And we have represented doctors that weren't ready to file. They wanted to make contact. They wanted to, start preparing in the event that they had to. And I've had doctors that have prepared and decided never to ultimately, file a claim. But in that, we've, reviewed the medical records, discussed with them the importance of getting into the doctors, what type of examinations, what needs to be seen in the records. And also, a lot of, internal medicine doctors, they have their own practices or they're part of a smaller group. So they can maybe start adjusting their scheduling. Reduction of duties and stuff like that is a little easier with internal medicine doctors to show that there is a decline. So if the physically speaking, you're having issues from your medical conditions, it's being supported in your medical records, and your work duties are declining, now we're getting towards like partial disability. It's very rare that we get a case where someone gets in an accident or there's catastrophic injury or a major medical event that all of a sudden there's a clear delineating day as to when disability occurred. We've also seen where they've worked those 2 years and they may have started seeing a decline. That decline they just kind of got used to, that was their new norm. And we've evaluated and said, well, listen, honestly, if we take a look prior to these 2 years, you might have been working at a reduced capacity that would make you eligible for benefits under your policy. So with internal medicine doctors, you can help prepare a case, I think, somewhat easier because they have better control of their schedules. But it really has to be done on the front end. It's very hard to make up ground when you're coming in kind of late in the game and an insurance company's already investigating. If we see someone calls us and they send us a letter and their carrier saying that, well, you've been working, you haven't seen a reduction in hours or earnings or duties, so what gives? it's really hard to figure out how to establish that that person at that time they filed was disabled under the policy.
And I really see this problem of the one doctor out of all the medical specialties, the internal medicine doctors are the ones who tend to grind it out more because they tend to be 95% in office other than when they're doing hospital rounds, and they just feel comfortable staying in the office in the sense of I'll see a patient, I'll go to my office for 5 minutes, I'll come back. But it sucks. I mean, it really sucks for them because they're suffering and they're grinding it out and they're trying to stay focused. And that job, like you mentioned earlier, it doesn't end at 5 o'clock or 6 o'clock when you go home, because you got patients in the hospital, you got hospitals calling in, you got patients calling in at night, even though, most internal medicine doctors' offices say call 911 if it's an emergency. But these concierge practices are becoming more and more frequent now too, and you are on all the time. And you can't take your painkiller at night or whatever and still be focused and remember the chart. And usually you're maintaining a history of hundreds of patients that you build a long-term relationship. This isn't the surgeon that you went to for a knee surgery or back surgery who sees you and leaves you. So really long-term relationship with the patients. And these doctors, internal med, they don't want to give it up. They're giving it up because they just simply can't do it anymore. And it's
and like you said too, most of them, it's whether it's their own concierge or it's their own practice, they're not working for a hospital. A lot of time it's, they built this practice through their blood, sweat, and tears, the time in medical school, getting board certified. It's not something you easily want to give up. Most doctors have that type of personality where you fight. You work too damn hard and you continue to do it. And I've usually found it's a really difficult decision for a lot of them to really be able to get to that point and be like, I don't think I can do this anymore.
I mean, I know you and I, we love representing doctors because it's the one profession where they're taking care of other people's lives, their health, their wellness, their fitness, and there's nothing more important in life than your health. But who is an insurance company to say, no, your doctors are wrong, you're wrong, go take care of the patients, you can do it, you just don't want to, is basically what they're saying. And it's the ultimate insult in life for a very well accomplished individual who's basically dedicated their life to caring for others. And now the insurance company basically, who probably never even examined them, looked at a record and go, well, you shouldn't be having as much difficulty as you are. So it's great for us to help these types of doctors to present their claim. But the doctor, and I understand, they think like what I just said, like, I can't do it. Who are you to tell me? But it happens all the time that they say you can do it. The other thing that's really actually good for internal medicine doctors is that they do have the option, if they have an own occupation definition of disability, to get out of internal medicine, which is tremendously demanding, on call all the time, and possibly go into another type of occupation. And many go on to become like in-house doctors for insurance companies where they're doing file reviews, things they can do on their own, things that are a one and done. I reviewed this file and I'm done. Or they work for medical boards where they're doing chart reviews, or they go work for the military if they have that type of army, if they have that type of background. And we have a lot of people that collect their full disability and go on to other occupations because their mind is still good. They just can't do the 12-hour days with the responsibilities that come with doing internal medicine. So best thing I recommend if you're internal medicine, internist, family medicine doctor, call Steve, call myself. We always offer a free initial consultation. We'll want to review your disability policy. If the carrier has denied you, we'll want to immediately review the denial letter. We'll let you know immediately through a phone call whether or not we can help you. I also want to encourage you to go to our website and search specifically for your disability company or companies, because you're going to learn a lot of information through articles that we've written, additional videos that we have specific to your company, lots of reviews about your company. The reason for all of this is it's not about us and what we do. It's about you being educated through other people's experiences. And the more education you have about your specific disability company and how to present a disability claim, the better position you're going to be to get approved. And that's the ultimate goal here, is to get your benefits approved. You paid premiums and you should be getting these benefits paid to you if you're not able to do your job. So we're able to help you anywhere in the country. We appreciate you taking the time to watch this video. We put videos out like this every week that you may find helpful. And if you don't need us now, you may continue to find these videos helpful, which you can subscribe to our YouTube channel. give us a call. We'll be here when you need us. And thank you for considering our law firm.